was it proved that HIV causes AIDS, and in what publication?
Well, it's been proved in many publications, but the formal Koch's postulate, which is where you take an organism and you inject it into an organism and reproduce the disease, of course can't be done in people for ethical reasons. But the studies have been done in different primates, in macaque monkeys, and in chimpanzees. So simian HIV causes simian AIDS, and chimpanzee HIV causes chimpanzee AIDS. And we know that people who have HIV, human beings, develop AIDS when their immune system deteriorates. The primary reason HIV damages the immune system is that there are these cells called lymphocytes, which kind of are the engineers of the immune system. They direct other cells in the immune system to do different functions. So they're kind of like at the highest level of the immune system by directing these other cells. And the helper lymphocytes have a receptor on their cell surface, which is called CD4, and that's the primary site that the HIV virus binds to. So it specifically targets these lymphocyte cells. And when the HIV invades these cells, it kills the lymphocyte cells. Therefore, the immune system deteriorates because it's losing its control from the top down. AIDS is defined in terms of the effect of HIV upon the immune system. So one of the definitions would be when the CD4 lymphocyte count drops below 100, 200, that would be the definition of AIDS. When somebody has a so-called opportunistic or AIDS-defining illness, such as pneumocystis, which is a kind of pneumonia that people with bad immune systems get, or a variety of other diseases, then that's classified as AIDS. But you're quite right that AIDS is not a medical diagnosis as much as it is a purely arbitrary definition based on arbitrary parameters that were set by a variety of different agencies. There is a subset of people, maybe 5%, who are so-called long-term non-progressors who have HIV, but they don't get sick from it.
Are studies only being done on people and the efficacy of HIV positive or AIDS patients on meds?
No, I mean, there are a lot of studies done prospectively on big cohorts that follow people off of therapy. And in fact, that's how one of the new classes of HIV medicines was discovered, which is that the so-called long-term non-progressors tend to have a mutation which alters a co-receptor for the virus on the lymphocyte surface, and by blocking that, you can block the virus from entering the cell.